I have a question about MIPS Measure 130, documentation of current medications in the medical record. The specs say, eligible clinician attests to documenting in the medical record they obtained, updated, or reviewed the patient's current medications, or documentation of a medical reason for not. I'm trying to determine if the documentation has listed the medications and the clinician signs the note, if that is enough of an attestation, or would we need a separate attestation statement? If our EHR has a hard stop to reconcile medications, does this hard stop count as an attestation?
Oh, great question, Rick. And I think this is important to a lot of people out there. Measure 130 is a fairly common one to submit. The answer is really in the specifications, even that in that part that you quoted. The eligible clinician attests and you completed that for us. Medicare's actually looking for an attestation. And that makes sense if you're understanding the measure and the dynamics of how this data is collected and recorded. And again, getting back to the specs, if Medicare audits your records, they're going to be looking for that attestation that indicates that performance was met in the fashions that they describe, both in that sentence of the specifications you quoted or in the preamble of Medicare. And part of the specifications, Medicare discusses the rationale and what they're expecting to see, and some of the color is in there. Now, there should always be a medication list in the electronic chart. That is, of course, unless the patient is on no medications, then there is a list that's just invisible. But now the list can be right or wrong. You can be right that they're on medications or wrong that they're on these medications. What Medicare is asking you to do is test to see if your list is accurate or not. And they want you to do that every visit. Now, unfortunately, doing the work to test its accuracy creates no reliable tags in the EHR database. I'm always looking for tags that get developed in the course of doing the work. And there's nothing in the course of testing the accuracy of the list that leaves tracks that we can find in a query of the EHR database. So you're really stuck with a position that you have to attest that yes, I did this. So you'd think that maybe a prescription shows that you did it, but if you're e-prescribing, making that prescription during the visit leaves tracks that say you prescribed, you created this prescription, but it doesn't tell us that you did it in the setting of having confirmed what other medications the patient's already on. And also subtracting a med or adding a med to the list also doesn't, you may have just been giving attention to that particular medicine for the reason of the chief complaint today. It may not have been done in the context of checking the accuracy of the whole list. So I think there's no other way than to build in an attestation that a patient or that the provider can select. And I don't think I can't imagine a hard stop in the EHR that is believable, that is credible. It makes sense that you're not always going to be able to test the validity of the medication list. You may not have time either because of everything else you have to do for that patient or other patients before or after. It might not be possible for the patient's level of consciousness or awareness of the meds they're on. So an automatic attestation or a hard stop couldn't be credible. It just demands a lie if I want to finish my work for the day. So my bias is there should only be one medication list in the chart. I don't like putting a list of the medications in separate problem lists. It just introduces duplicate work, saying it all again, or rewriting it, so having the system automatically put it in from the record, and it demands that it be read. You're not really doing your job unless you look at that, and it introduces a whole set of possible errors. That list should be irrelevant the next time there's a medication change, a deletion, an addition, a swap out. So it doesn't live on, and I did an informal study back when I was in practice of all the number of different lists of medications each patient had, even in my own office, and then how it rose geometrically as you stepped away from the office and into the affiliated practices. We need one. It needs to be checked regularly. Your work with a patient should be to test its validity, not to redocument it, not to relist it. And when you do that, since you're not leaving tracks on the chart, you should be saying I do, and with with room for variation. And what I'd like to see is just that attestation. I checked it, or if you don't check the box, it did not, but also room for a little explanation because it is different. I checked it because the patient had a credible memory of what medications they're on. I called the pharmacy and confirmed that these were the most recent medications. Or a family member came in and validated it. Explain how you did that adds a little more credibility and and a clue for what you need to do in the future when you're ready to validate it again. So I'd say, your note, every list in the EMR or the EHR should be referenced, not repeated. I would do that with a problem list, see problem list, um, see family history, see allergy list, that sort of thing. Never make an extraneous copy of those lists or dictate them in. Or it can be a time saver and a quality booster if we refrained from duplicating that work. And someday I think we can be free of that requirement to say see medical record or see medication list, see allergy list. Most EHRs already have the capability of tracking your trip through the EHR, and people with the right forensic EHR skills can tell you, for this visit I spent this many seconds in the medication list, this many seconds in the immunization list, et cetera, et cetera. So I'm afraid there's no simpler way to deal with this than an attestation, and you should avoid any temptation to hard code it into your notes. It has much more credibility if the provider checks it off, and even more if the provider explains it with just a brief statement. Doesn't have to be anything lengthy. A couple words is fine if it explains what happened.